In my last video, we discussed the diagnosis phase, and I argued that sometimes getting a definitive diagnosis isn't worth it. In this video, I will discuss the ways you can still move forward with your healing, even if your illness doesn't have a name. My name is Candace McGarvey, and my first suggestion is this: find a good doctor. I know, the last video I made the point that doctors don't understand long COVID, but that doesn't mean we are done with doctors. They may not be able to diagnose us, but they can help us with some of our symptoms and improve our quality of life. The discussion about the right doctor can be difficult because I know many long haulers who are forced to rely upon treatment from hospital emergency departments. That's not ideal, obviously. It causes the physician to have no sense of your history, and it's likely that you will either be misinterpreted or not believed. It would be a better option to find a doctor who supports you before you end up in the emergency room. Then your doctor can vouch for you and help you convince the hospital that you're not crazy. So where do you find a doctor who will do that? First of all, you need a practitioner who has an open mind. For the next few months, at least, you will want to find someone who will admit that COVID diagnostic testing is a mess. Now, it won't be easy to get them to go on record as saying that, especially not in the US, where testing has become a political mess. But you might start out by asking your doctor about the incidence of false negative results on the diagnostic tests. If the doc agrees that there's a problem with false negatives, then he or she is probably going to have a realistic outlook on the pandemic. But if a doctor says, "Oh yes, those diagnostic tests are plenty trustworthy," I would find a new doctor. You are looking for someone who recognizes that we don't yet know what we need to know to treat this effectively. Keep in mind, our society does not easily accept doctors who answer our questions with, "I don't know." So if you find a doctor who admits their own limitations and the medical industry's limitations in general, hold on. That is the right kind of doctor for our times. My next suggestion is to seek a specialist. Ideally, we would be able to find doctors who can treat the whole body and understand the root of our illness and all the different systems it has affected. But all we know is the root is a virus, and that is still a mystery. But the medical industry has done years of work on many of the individual symptoms we are having. If you can find a remedy for even one of your symptoms, your quality of life improves, giving you more of the energy you need to heal the rest of your body. So whatever symptom is giving you the most trouble, start with that specialist. Now, depending upon your healthcare system, you may need a general practitioner to give you a referral to a specialist if the cost of the visit is going to be covered. So what's your worst symptom? If it's lung-related, find a respiratory therapist or pulmonologist. Where it's heart-related, find a cardiologist. Got pain in your joints, muscles, or bones? Find a rheumatologist. A neurologist would treat many symptoms, including brain fog, which includes impaired concentration, being at a loss for words, slowed thinking, difficulty making decisions, and difficulty remembering what you were just talking about. Other neuro symptoms can include a variety of headaches, sensitivity to light or sound, interrupted sleep patterns, and a partridge in a pear tree. Now, set your expectations for your first few appointments with your doctor. Because there is no established criteria or treatment for COVID, your doctor will likely want to put you through the tests to rule out the well-known diseases before recommending any treatment. That's just good medical practice. In my research, I have found COVID long haulers who have gone this route and are receiving treatment for dysautonomia, fibromyalgia, and mast cell activation syndrome. Now, if you're unable to see a specialist or can't stomach all the lab fees and physical energy that process will cost, you might consider looking for help outside traditional medicine. There are lots of naturopaths, chiropractors, and acupuncturists who have some very interesting ideas that could improve your quality of life. The chiropractic neurologist I visited was the only doctor to ever give me a satisfactory description that explained all of my symptoms. He called it chronic creeping crapulitis. His intention was to heal my gut to help the rest of my organs function properly so they could rid my body of all the crapulitis. The point of all of this is we don't have the luxury of finding an exact diagnosis. So in the meantime, we need to look for some hints that will help us understand what our bodies are going through. And if you really need to be able to tell inquisitive people what you have, just tell them you have chronic creeping crapulitis. Now, how can you improve your relationship with your doctor? I have 2 suggestions for your first appointment. 1, bring notes about your condition. If you have been meticulously documenting your symptoms, you are less likely to be dismissed as a forlorn and passive Debbie Downer. Keeping track of your symptoms shows a level of personal involvement and a willingness to be part of the solution. Now, I know you don't have a lot of extra energy for this kind of tracking, so you may need to get creative. If you can't write, make a voice note or even ask someone to create a chart with your symptoms on it so you can just write down the date or put a check in the column whenever you experience one of the symptoms. This is probably a good time to start talking about getting some support. So since you've been sick, who in your life still gets you? Is there someone who believes you when you say you are sick, who notices that you're not who you used to be? It might be a family member, could be a friend. Maybe that person can dress up, look trustworthy, and go with you to your first appointment with the doctor to articulate and advocate on your behalf. I had to travel many hours to New York City to see one specialist, and I was so sick that when I was introduced to the doctor, all I could do was teeter from my walker to the closest semi-flat place so I could lay down and mumble, "Fix me, please." But my brother-in-law accompanied me to that first appointment. He was on his way to work, so he was dressed in a suit, and he told the doctor, "This is not the Candace we know. She is normally an active person who is courageous and who goes after whatever she wants. This illness has completely reshaped who she is, and we need your input on what is happening." Not only is having an advocate good for your relationship with your doctor, it's good for you. You need someone who believes you and wants to support you in difficult times and who will hope and pray for your recovery. If you don't have anyone like that in your life, I have started a Facebook group to match long COVID patients with other long haulers who are far enough ahead in their journey to be able to advocate for someone else. You can find the group on Facebook by searching Support for Long Haul COVID Survivors. One more thought on this topic. If you are a person of color, bringing an advocate with you can make a huge difference in your treatment. I absolutely hate that this is the case, but I have heard too many stories of unconscionable treatment where medical professionals not only wonder if a patient is crazy, that's standard issue for most of us long-haul patients, but in the case of one doctor, he accused his patient, a woman of color, as having overdosed. Thankfully, the patient's mother was there to explain her medical history and give that doctor the whooping that was called for. But until our society learns what justice really means, you may need to take extra precautions if you are a person of color. Okay, this has been intense. So let's talk for a moment about stressing less. I've mentioned in other videos the importance of letting your body rest instead of flooding it with cortisol. You actually have a structure in your body whose job it is to regulate your stress. Technically, it's regulating your inflammation, and it's called the vagus nerve. No, not Vegas, vagus. When we are worried or stressed, our body releases stress hormones that get in the way of the vagus nerve doing its job. So we walk around all inflamed until the inside of our bodies look like Will Ferrell in a Speedo with a sunburn. So here's the bottom line. Reduce your stress, reduce your inflammation. I recognize that after I told you to laugh more and be patient, it makes you want to smack me. And now that I have the audacity to tell you not to stress, I get it. I know my suggestions are obnoxious, but they come from a place of experience, because this is what has worked well for me and so many others who were in your shoes. In my next video, I will discuss ways to strengthen your vagus nerve and other methods that long haulers have used to successfully begin to heal. Until next time, Get better, everybody.